Good day, everyone. My name is Dr. Fundi a qualified family physician and also a chief executive of Proactive Health Solutions, which is an employee health and wellness company that's been in existence for the last 23 years. Welcome back. We are still on our inaugural podcast that's named Health Matters with Dr. Fundi. So, on this second segment of our podcast, we are going to be focusing on matters relating to the parliamentary processes in relation to the National Health Insurance Bill, the amended National Health Insurance Bill that was approved by the Portfolio Committee on Health at our parliament. And this took place on the 26th of May, which is just about a week ago. Friday, 26th of May, 2023. Now, before we focus on what that is, I think let's go back a bit to talk about what is NHI, at a high level, because the time that we have, we can't be able to go through everything about the NHI. But I think what we need to say is that, firstly, our constitution in South Africa, which was adopted in 1996, that constitution guarantees certain, rights to the citizens of this country. And one of those basic rights that are enshrined in our constitution is the right to access to quality healthcare by everyone, all the citizens of this country. Now, for that right to actually be a reality, there is an obligation on the government to ensure that it does everything within its power to ensure that every citizen of this country has access to quality healthcare services. Section 27.1 to be specific, actually says all citizens of this country, I'm paraphrasing it, I'm not using the exact words, all citizens of this country have a right to access quality healthcare. 27.2 actually reminds the government that it is the obligation of the government to actually ensure that those rights are actually realized. 27.3 focuses on the fact that everybody who requires emergency care must be provided with that emergency care, whether it's a private or public sector. So if one looks at where things are at in South Africa, 29 years since our democracy, one needs to be able to say that what our constitution envisaged and the reality of today in terms of access to healthcare by all South Africans, there's a big gap. There's serious issues of health access inequity in South Africa. Part of what we see are some remnants or problems that actually predated the current government. Remember, before 1994, there were so many different departments of health. Each of the homeland governments and the self-governing states, they had a department of health. You also had NPA, TPA, CPA, that is provincial administrations. There were 4 provinces prior to 1994, and each one of those had a Department of Health. Like I've said, National Provincial, Authority, Transvaal Provincial Authority, Cape Provincial Authority, and the Free State, Provincial Authority. So in 1994, all of these needed to be amalgamated to form one national health department and provinces to deliver the services. So when one looks at, do we have a situation in South Africa today where we can say everybody has got access to healthcare? The answer is a big no. In fact, what we have is a 2-tiered system, a private healthcare system that is largely being used by those who are affluent or lucky enough to have jobs where the employers are actually subsidizing medical aids, or government, workers. And that's about maybe 7 to 8 million, South Africans. About 15% of our population actually enjoy access to private healthcare. The majority of our people in South Africa, at least about 85% of them, they actually have to make do with using the public healthcare system that's funded by government. When one looks at the funding of these systems, respective systems, it is said that about half of the annual expenditure in healthcare in South Africa is spent by the 15% of the people who use the private health sector. It's also said that about another half of our annual expenditure as a country is spent for the remaining 85% of our people in South Africa. So just from that funding perspective, you can see that there are serious funding, inequities. So can one say that right in Section 27, as far as healthcare access is concerned, is actually being realized by our people in South Africa, the majority? The answer is a big no. We also know that South Africa is a member country within the World Health Organization. And a resolution was taken a few years ago at the WHO that by 2030, there must be universal health coverage in each of the member countries. So as part of that commitment that South Africa was part of making at the WHO, there is therefore moves to put in place a universal healthcare coverage, which we refer to as the National Health Insurance. So there has been a long process of a bill that is supposed to ensure that ultimately there is a law, an NHI law. It's been over 4 years. In fact, the whole process started around 2010. But the actual bill, NHI Bill, has been around since around 2018, the second half of 2018. It's gone through a lot of public participation by various stakeholders in South Africa. And that long process of engagements with different stakeholders has resulted in the NHI Bill, amended NHI Bill, being approved by the Portfolio Committee in our parliament. Of the 10 members of that committee, 6 of them being ANC and 4 being opposition parties, 2 from the DA, 1 from the EFF, and another one from what is it? I've just forgotten the name of the other party. So out of those 10 members, 6 voted in favor and 4 they voted against. So that process now is a landmark process because it heralds the next stage whereby the National Assembly must debate this approved NHI bill by the Portfolio Committee. And from there, it must go to the National Council of Provinces. If it's approved at both of those levels, then it will go to the president, who will have to apply his mind on constitutional, issues and decide whether he's comfortable enough to sign it into law. Now, many people who have been looking forward to this NHI, especially those who are making use of the public health system, they are actually happy at the news of the approval of this NHI bill. But many people, especially those who are interest groups, largely in the private health sector, and opposition parties, for many reasons, are not in favor of this bill. In fact, their biggest gripe is that they say the government, or they say the parliamentary process in Parliament ignored a lot of their inputs, which were meant to ensure that the bill, once it is approved, is a much more improved version than what they had actually, gone through. So their big gripe now is that there has been minor changes despite this long participation process. They feel that their inputs were ignored, and many of them are actually threatening, legal action. And so I'm just going to read just one article that appeared on the JUTA, medical brief, because it gives you a sense of what is happening out there. So on the JUTA medical brief that came out on the 31st of May, 2023, this is a weekly, publication that is quite useful in the medical or health space. There's an article here. It says, litigation threats as NHI bill is passed by the parliamentary committee. I'll just read a few things from this article. It says, threats of legal action have predictably followed the adoption of the National Health Insurance Bill, with only slight amendments by the parliamentary committee members, despite a string of concerns raised by various stakeholders and conflicting legal opinions still unresolved. The South African Medical Association, which is a body that represents medical doctors, reacted strongly, saying it rejected the bill in its current form. And the Solidarity Trade Union says it is considering a constitutional challenge to the draft legislation, which was given thumbs up by the Portfolio Committee on Health. Remember, this bill has been under consideration for 4 years, with concerns being raised by Parliament's legal advisor and opposition parties, and input received from a multitude of stakeholders, from private healthcare providers to patient advocacy groups. So already there are those threats of legal action. If we look at the view from the biggest medical scheme in the country, Discovery Health, it is quoted in this article that Discovery Health CEO Ryan Noor said he was disappointed that the amended version of the bill varied little from the original. The article goes further, quoting him as saying, Discovery Health does not support the single funder model proposed by the document, nor its restriction on medical schemes to only offer cover for services not included under NHI. Just to expand on this issue, I think it's Section 33 of the NHI Bill actually says, once NHI has been fully implemented, private medical schemes will cease to exist in the current form. They will have to provide top-up or supplementary, offerings that are not covered by the NHI basket of, of services. So one can understand, therefore, why the biggest medical scheme in the country would actually, be disappointed by the fact that Section 33 or Clause 33, which actually says there will no longer be medical aids as we know them. They will only be there as top-up for the bells and whistles that are not covered by the core basket of services from the NHI. So I think it is important that South Africans actually, share their views on this matter. Remember, in 29 years of our democracy, the healthcare system is one of the areas of, South Africa that has not really been transformed in a meaningful way, especially to align it to our constitution. So the government on one side, they have to make sure that in line with that 27.2, they make decisions to ensure that there's a realization of access to healthcare by all. So they have that obligation. But on the other hand, we have the experience of how things have been going in South Africa as far as healthcare is concerned, the delivery at provincial level, but also policy and other legislative matters at a national level. A number of people are skeptical about whether South Africa can actually be able to deal or to roll out this national health insurance. Just yesterday, on the 1st of June, on the 702 FM, there was an interview with the outgoing health ombuds, Professor Malekapuru Makgoba, and he was asked about NHI. What are his views? And his views was, we definitely need a universal healthcare coverage system in South Africa. But when pressed further on whether he thinks the current government can be able to deliver on that, his answer was a big no. So that comes from somebody who's been at the helm of the public protector for health for the last 7 years. That says a lot. Now, a number of people, on principle, don't have an opposition to universal healthcare coverage, which are the principles behind NHI. It seems the biggest problem is about questions on the capacity or the capability of our government to deliver on that. Many people say this is going to be a creation of a super SOE, something even bigger than ESCO, with a budget, 500 billion or more per annum. And they worry about issues of leadership, management, and more especially, the use of the financial resources. Many people are raising the issue that during the pandemic, just a few years ago, our government allowed situations whereby there was a lot of corruption relating to PPEs and other issues. And so those things are still fresh in the minds of many South Africans. And one cannot judge them for their skepticism, because almost every week we hear of things that are not working well at provincial level. I mean, there's a story about kids at Mahikeng Hospital who had to be put in cardboard boxes because there were no appropriate, facilities to put these newborn babies. We hear about, issues of cholera and people dying in Hammanskraal, with the hospital there being, the Jabulani Hospital, being inundated by patients with cholera. So there's stories in almost every province about issues of healthcare whereby definitely people are not getting what the Constitution expects of them to get. So there definitely is that is in the minds of many. But I think it's also important to say, during the pandemic, those countries that had a universal healthcare coverage, they actually fared better in terms of ensuring the mobilization of resources for their people. They had fewer people dying. They were better prepared to, protect their population against the pandemic. So there are benefits of having a functional universal healthcare coverage system. But I think it is the nuts and bolts, the how, by whom, and what oversight is going to be there. Because we understand that the way this thing is going to be funded, everyone who's working, informal and informal, employment, they will have to contribute money via taxes to SARS, and money that will then be passed on to the NHI fund. And that NHI fund, which is the super SOE that people are talking about, will then be the single purchaser of healthcare for all South Africans in the country. They are the ones who will determine, which tablets to be bought, which operations to be done, what can be included in the basket of services, what should be excluded in the basket of services. So it's going to be a very, very powerful, SOE. And people looking at what has happened to the SOEs across the country, they are not filled with confidence, and they're actually quite skeptical. So I think it is important that we follow what's going to be happening here. And on this digital platform, Dr. Fundi, through the podcasts that we will be, sharing on a weekly basis, but also through live interviews with some of the key stakeholders from the ministry at national level, at provincial level, and even at local government level, we'll endeavor to interview those people and ask questions and allow members of the public to ask questions. At this point, we are very polarized as a country as far as NHI is concerned. And being a country that already has got serious financial problems, issues of affordability of the NHI are also coming, into play. So in the future podcasts, we will go deeper on some aspects of this. But at this moment, I just wanted to, to say, as a country, this is the biggest radical proposition in the healthcare system. And we need to be able to engage with it, because all of us will become members of the NHI, and all of us will have to make use of those services, because only top-up services can be bought through medical schemes. Private healthcare service providers will have to be contracted to provide services to the NHI, as well as the public health facilities. So looking at the next coming months and years, with the date for NHI having been communicated before that it should come into play by 2026, I wonder if those timelines are actually going to be followed, or there will be revision of the timelines. But one thing sure is that there is political will to have this system of healthcare delivery being implemented. Surely by 2030, as a member of the WHO, the country will have to present their progress report. And so I don't think, there's a turning back as far as NHI is concerned. But I still think, as a country, there could still be an opportunity for more, amendments to what has been put in place, and some of those may be forced by the courts. So let's watch the space. Thank you.